Hello, gentlemen. If you're over 50, 60, or even beyond, and you've noticed something unusual during intimacy, you still feel the full wave of pleasure, that unmistakable moment of climax, but there's little or no seminal fluid. This message is especially for you. Maybe it happened once and immediately triggered worry, or maybe it's been happening quietly, repeatedly, and you haven't told anyone. Many men feel confusion, embarrassment, or even fear when this occurs, wondering what it means for their health, their masculinity, or their future. I want you to take a deep breath. I'm Dr. Olivia Parker, a urologist with over a decade of experience working with men at every stage of life, and today, I want to speak to you honestly, clearly, and without judgment. First, let me say this plainly. What you're experiencing does not mean your manhood is gone. It does not mean intimacy is over. And it does not mean you should panic. Think of this not as a failure, but as a message from your body. A message that can be understood, explained, and in many cases managed. Stay with me, because over the next few minutes, I'll explain why this happens, when it matters, when it doesn't, and what modern medicine can do to help you move forward with confidence and peace of mind. Before we talk about what's missing, let's briefly understand how things normally work. Without medical jargon, your reproductive system works like a perfectly timed orchestra. The testicles produce sperm, the seminal vesicles add most of the nourishing fluid. The prostate contributes protective enzymes. All of this is collected and prepared in the urethra. At climax, a precise sequence of muscle contractions pushes this fluid outward. It's fast, powerful, and depends on nerves, muscles, and glands working together in perfect timing. Here's something many men don't realize. Orgasm and ejaculation are not the same thing. Orgasm is a neurological experience, pleasure controlled by the brain and nervous system. Ejaculation is a mechanical process, the physical release of fluid. For most of your life, they happen together, so it feels like one event, but they are actually separate systems. What we're talking about today is called dry ejaculation. When a man experiences orgasm but releases little or no fluid. Many men describe it as an empty orgasm. The pleasure may still be there, the sensation may feel normal, but the expected physical sign is missing, and that disconnect creates anxiety. The important thing to understand is this. Your pleasure system may still be intact. The change is usually in the delivery system, the plumbing, not the wiring. Let's talk about the 3 most common reasons this happens. The first, and most common cause, is something called retrograde ejaculation. Inside your body, there's a small muscular valve at the opening of the bladder. During climax, that valve is supposed to close tightly, forcing fluid to go forward and out. If that valve doesn't close properly, the fluid takes the path of least resistance, backward into the bladder instead of outward. You still feel orgasm, but the fluid doesn't appear. A practical clue many men notice is cloudy urine after intimacy. That's simply the seminal fluid mixing with urine. It's usually harmless. This often happens after prostate or bladder surgery. Those procedures may save lives, but they can affect the delicate nerves controlling that valve. Certain medications, especially those for enlarged prostate or high blood pressure, can also relax this muscle. I've seen countless men feel devastated by this change, only to feel immediate relief once they understand it's a mechanical issue, not a loss of desire, pleasure, or identity. The second major cause is duct obstruction. Your glands may still be producing fluid normally, but the tiny ducts that carry it are partially or fully blocked. Think of it like a pipe that's clogged. Production continues, but delivery is reduced or stopped. This can happen due to scarring from past infections, especially untreated prostatitis. In rare cases, tiny calcifications can form and block the passage. Some men notice mild pelvic discomfort during climax, or that fluid volume slowly decreased over many years. The good news? Many of these obstructions are treatable, sometimes with medication to reduce inflammation, and in some cases with minimally invasive procedures that restore normal flow. The third key factor is hormonal changes, particularly low testosterone. Testosterone isn't just about desire or erections. It fuels the prostate and seminal vesicles, the glands responsible for most of the fluid. When testosterone drops significantly, fluid production slows. At first, you may notice less volume. Over time, you might also experience reduced libido, weaker erections, less intense climax, fatigue, mood changes, and loss of muscle mass. This condition, called hypogonadism, is diagnosable with a simple blood test. When appropriate, carefully monitored hormone therapy can dramatically improve not just fluid production, but energy, confidence, and overall quality of life. This is not something to dismiss as just aging. Aging doesn't mean neglect. Now, I need to speak to you as a doctor. Most cases of dry ejaculation are manageable, but there are situations where it's a warning sign. You should seek medical evaluation promptly if dry ejaculation appears suddenly and is accompanied by pain, blood in urine, or semen, fever, numbness, or loss of sensation. Certain neurological conditions, long-standing uncontrolled diabetes, or rare urological cancers can interfere with nerves or muscle control. These are not reasons to panic, but they are reasons to act. We also need to acknowledge the emotional side. Many men equate ejaculation with performance and masculinity. When it disappears, anxiety, shame, and self-doubt creep in. Some men avoid intimacy entirely, not because they've lost desire, but because they fear judgment. Let me be very clear. Your worth is not measured in milliliters. Your ability to connect, feel pleasure, and enjoy intimacy does not disappear with fluid volume. Understanding the cause replaces fear with clarity, and clarity restores confidence. Here's a simple action plan. Don't ignore it. If this change is new or progressive, see a urologist. Diagnosis is often straightforward. Manage chronic conditions like diabetes, blood pressure, and cholesterol. These directly affect nerve and vascular health. And most importantly, break the silence. Talk to your partner. Talk to your doctor. Silence creates fear. Conversation creates solutions. Gentlemen, dry ejaculation is not the end of your intimate life. It's a signal. One that deserves attention, not shame. With the right evaluation and care, many men regain confidence, vitality, and peace of mind. If this message helped you, share it with someone who needs it. A friend, a brother, a father. Like the video, subscribe to the channel, and stay connected for honest conversations about men's health. Your best years are not behind you. They're protected by knowledge, action, and self-respect. I'm Dr. Olivia Parker, and I'll see you in the next video.